Hi, everybody. Welcome back to the Healing Point Massage Therapy YouTube channel. My name is Alana, and today I'm joined by the owner of Healing Point Massage Therapy, Lianna Bergonia, and she's going to be talking to us today about why drivers need massage therapy. How are you today, Lianna?
I'm doing very well, thank you.
Excellent. How are you enjoying the weather right now?
Okay, yeah, so it's great because now it's a little bit sleek on some area there, so yeah, just be careful. Yeah.
Are you seeing a lot of people that have injuries from shoveling?
Yes. A lot of people are just, I'm sore.
Yeah.
2 hours straight of just shoveling snow. So yeah.
And if not injuries, then just soreness.
Yes, soreness, yeah.
And you can help those people who are tired of winter.
Yes. Almost there.
Well, we're not going to be talking about winter today. We're going to be talking about drivers. So this covers things like taxi drivers, delivery drivers, your Amazon driver delivering all your packages because you don't want to go shopping.
Yes.
And so is that something that you see a lot of?
Yeah, we see a lot of drivers coming in. Yeah, sometimes the wives booked it for them. Yeah, because they complain they're sore, but they don't really want to book themselves. So the wives booking in for the husbands. Yeah.
Excellent. Well, if you are a driver or if you have a spouse who is a driver, stay tuned or send this video off to someone who is a driver and could use the information.
Yes.
So drivers not only spend a lot of time in a seated position, which is not always advantageous for the body, but they're constantly dealing with the vibrations from driving. They have repetitive stress injuries from getting in and out and unbuckling and rebuckling their seatbelt. And they're also carrying heavy packages. So delivery drivers and drivers in general is one industry that needs a lot of massage therapy, but it's also an industry that doesn't get a lot of massage therapy. They often think that I'm just getting older. And Lianna is here today to talk to us about why drivers especially need massage therapy. So what kind of physical strain do drivers undergo during the course of their day?
Well, we know that they sit a lot, like for their whole 8 hours, they're just sitting. So they're prolonged sitting. So there's, like as you said, the vibration, and then like there's not a lot of movement there. So there's limited movement, and this just fixed posture. That's it. There's no more room for movement, right? So those are not great because we as human body needs to move. We're designed to move, right? So those combination of four is just like not great.
Excellent. Mm-hmm. And what areas of the body are most affected in people who sit and drive all day?
Yeah. So as when people sit a lot, like same thing with you're sitting in a desk and stuff, right? So those, same muscle groups are being affected. So their hip, their lower back, their neck, their shoulder. So those are really, really affected. Especially increased tension in the hips, right? And lower back. Yeah.
Mm-hmm. What about the constant jostling, the vibration from their delivery vehicle, the rough roads and always kind of bouncing? What does that do to the body in general?
Yeah. So generally the bouncing is okay when, when we are moving, exercising and stuff like that. But when you're in a fixed position, just same amount of pressure to one area or to the bone or the hip, right? So it's kind of not great for your body. So it's about the movement too. The vibration is good with the movement, but not just a sitting position.
Right. Mm-hmm. So it's not even the same as a desk worker because they have that built-in vibration.
That's right. Yeah. Mm-hmm. Yeah. It's kind of different in that way. Yeah. Mm-hmm.
Why do so many drivers struggle with lower back pain, and how can massage therapy help that?
So, sitting compresses the spine, right? So when that happens, so you're not mobile, you're not moving very well. So then it weakens your glutes, our biggest group, muscle group in your body. So that weakens right away. And then it tightens the hip flexors, which is the opposite of that. So like what happens with imbalance of our body when something is weak on the other side, the opposite of it tightens up. So that imbalance create and then stays there for like hours. So then, you have a constant tight hip flexors and a weak glutes. Yeah.
And so how does massage therapy impact that? How does that help the drivers?
Yeah. So with massage, we know that we release the tense muscle. So most of the muscle group that we'll work on, like, the quads, the hip flexor, just make sure that those are loose to straighten up, because they're all have been like fixed to a flex position. And then we're going to also work in the glutes to just like really work on like awaken those muscles there that been sleeping because they're weak. So those are and then of course the back and the shoulders and neck. So those are the group of muscle that we do because of this whole this position that's been holding on for 8 hours. So yeah, we just wanted to break that and open those areas that has been like chronically tight.
Right. Mm-hmm. So it helps the muscles, but does massage therapy also affect the stiffness from being in the same position and like help with the circulation throughout the body?
Oh yes, yeah, absolutely. Because when you're not moving, there's no blood flow, right? So that really helps. Even just a blood flow going, and then your body will realize like, oh my gosh, I can actually move. I can put more new blood to that muscle, or regeneration and all that. That's so important. As aside from just working with the muscle, just those tight muscle. Aside from that, I think it's a whole. Like the whole body just going to benefit from that. So just coming from massage.
And that blood flow will help heal the muscle as well. It's not just the massage of the muscle that's going to help. It's the increased blood flow that the massage will have, correct?
Yes, that's right. Yeah. Because healing comes with, there's some, that's why there's some areas of our body that is longer to heal, like the tendon or ligaments in that area, because there's not much kind of blood flow to them. Okay. Right. So anything that's like a muscle, if we can try and loosen them and like get some blood glowing, get them moving, get those fascia moving and help them, that will create a balance to the body for sure. Mm-hmm.
Great. And what are the things that you're seeing in the bodies and the posture of drivers that come to see you? What are your therapists finding?
Actually, I'm just going to correct this right away. I'm like, so it's a lot of a forward head posture, right? This shoulder rotated, anterior pelvic tilt. So that means it's like their hip is like forward, because the hip flexors are tight, right? So the hip will tend to tilt forward. So then that will end up with the glutes muscles weak. So that create that. And then so this is like forward head. So so those are imbalanced with the posture. Yeah.
Wow. One thing that my partner noticed, he's a delivery driver with Canada Post. Mm-hmm. He didn't realize that the constant putting on and taking off the seatbelt was going to impact. Yeah. And he developed a rotator cuff injury because he drives to the next community mailbox, gets out, delivers the mail, gets back in, drives to the next one. He's putting on a seatbelt and taking it off a lot. I didn't realize that even that was a risk.
I can see that. Yeah. Especially when like every maybe 5-10 minutes they have to do that next house, right? Yeah, I can see that. Again, it's a repetitive task, right?
There's a lot of impacts to the body that you don't even think about.
Mm-hmm. Yeah.
So how quickly can drivers expect to see an improvement of their symptoms when they come get a massage?
So usually if they've never, it can be like, some people have never done massage. So that will be like, okay, this will take time, come in for weekly for 4 to 6 weeks. And then it depends on how your body is doing. And then usually we'll try to extend that to a little bit more to a monthly visit for a more regular maintenance.
So what does that more regular maintenance do to the body?
Well, because you're still going to do the job. Yeah, same. So your body will still going to muscle memory. It's like, oh, okay, I'm gonna go back to this position.
Right.
So if you're not doing anything from that and still doing that, so it will just going to go back to your pain, right? So we can't just like do all the effort from the therapist, from the massage therapist. You have to make an effort too at home, right? So there's some home care that needs to be done, and you can always ask your massage therapist what they can do, right? There's a lot of stretches that to help that open up the hip flexors and then open the chest and neck, and then strengthening the glutes is really important, and the back. So because you're like becoming to like a ball, so a lot of stretches will be going to the like the front, and then a lot of strengthening is going to be like all the back muscles, right? Because you wanted to reverse the posture that you're creating.
So what I'm hearing you say is that you need more than one massage.
Yes.
You can't just go to one and expect that all your problems are solved.
Yes. Yeah. It's going to be like a partnership with to be better, right? Yeah. So getting massage to help you, and then doing the rest of the effort, for like home care exercises.
Great. Mm-hmm. And your therapists will tell each patient what, how often they should come back, as well as what they should be doing for stretches in between.
Exactly. Yeah. Mm-hmm.
And I hear that you also have a new little tool that you have at your location that people can purchase to take home.
Yeah.
That will help with that. Can you tell me about that?
Oh yeah, it's called 2Z massage hook. I don't have it with me. Next time I should bring it with me. But it's like a hook. At the end of it, it's like a roll. There's a real little rolling thing, and that between sessions, we recommend using that to just deactivate those trigger points on your back. And many clients that I see definitely see the benefit of it, to just between sessions and loosen it before it becomes like worse. And sometimes you get that trigger point in your back. So I'm like, okay, I got to release that. And it's one client tell me, oh, this is better than my husband. Finding that trigger point on my back, because it's just kind of right there, you're the only person that will know where the trigger point is. And that massage tool is definitely a great tool. Yeah.
That's great. So delivery drivers can grab that 2Z, they can hit that trigger point and feel better.
Yes, exactly.
Great. Better than a husband. I like that. Your husband can just go back to being your loving spouse. Not your massage partner.
Yeah, so funny.
That's great. So what can regular massage appointments do to help the driver overall release their tension during the job? What impact will that have on them?
Well, aside from they're getting their tension released, they're going to find out that they're going to move better. They're going to find out that I can go back and forth to the car easier, it's like those things. I'm like, oh, I can actually, it's the mobility as well. And then they can have, because they're getting a lot more blood flow to their body, they're getting more relaxed, they can sleep better, So it's a lot of benefits of getting massage.
Excellent. What would you say to the delivery driver, or just the driver? They don't have to be delivery driver, but someone who drives for a living, who says that the stiffness and soreness is just part of the job or part of getting older. What would you say to them?
In a way, there's it's part of the job, yes, because it's still same position, right? There's no other position to like driving. It's the same like this. So it's either like they do something about to help them get to have a longer career, right? So it's kind of depends to them of are they gonna do are they gonna have help with some massage therapy or other treatments to help them? Are they gonna start like stretching or strengthening some muscle that will help them to have, to do what they love to do, like, which is, if that's something that's a career that they love to do, right? So there's, yes, it's part of the job. It's like, as we age too, it's like the healing is not the same as when we're younger. So the more we're getting older, the more we needed help for getting those muscle loose for sure. Yeah.
Excellent. And I know that at Healing Point Massage Therapy, you don't just do massage therapy, you also have other services. What are some other services that you offer that can help drivers?
Yeah, so aside from massage, then we have the acupuncture. So acupuncture, they help a lot with, they can even help with the tightness, and it can also help with, just relaxation, and any other ailments that they have. They treat a wide range of ailments, and of course we have a manual osteopathic therapy. So that one focuses on focusing the whole body and finding restrictions, so like a deeper restrictions to your body, that not just working with your muscle, but working on the structure, the fascia, like other parts of your body, that not just the muscle, right? So, and then finding restrictions that you don't know that's been there, or old restrictions, old scar tissue, old injury that you have forgotten. And then, the therapist can okay, why is this restricted? And that's causing, say, ankle issue that have been there like for 20 years ago. And then now we're causing some neck issues. So, those kind of connections to the body that we didn't realize that, it's there.
Right. And one thing that's really always surprising to me is if you have an injury on one part of your body, you may not feel the pain in that same. I know that I was having hip issues, and when I was in for my last massage, the therapist said the hip issue is actually causing a shoulder issue in the opposite shoulder because of how my body is holding the pain.
Yeah.
So if you have other issues, it can refer to the different parts of your body.
Yeah, it can refer. Yeah.
Wow.
And that's what I think that's kind of how manual osteopathic therapy is different kind of from other, because it looks at the whole body as a whole to treat.
That's excellent. Well, thank you so much for educating us about what you should do if you're a driver and you're feeling some body pains.
Yeah,
how can people book in an appointment?
Yeah, so they can always call us 780-569-3838. And they can also book online at our website, healingpointmassage.ca.
Excellent. So they can book in online, they can call in. It's very easy.
Yes, yeah.
Wonderful. So if you know someone, or if you are someone who drives a lot for a living, whether you're an Uber driver, a taxi driver, a delivery driver, and you're feeling aches and pains, know that that's not normal. It's not a regular sign of aging, and there is help at Healing Point Massage Therapy. Lianna and her team would love to help you out. So please like this video, share it, and subscribe to the channel so you can get all of our helpful tips on future videos. Thank you so much, Lianna. I really enjoyed today's conversation.
You're very welcome. See you.